Hi everyone, Assalamu alaikum. Today I am going to talk about anemia in pregnancy. Around 90 to 95% of the cases, anemia in pregnancy is due to iron deficiency, and which is the most common form of nutritional deficiency. According to World Health Organization, hemoglobin less than 11% in a pregnant woman is anemia in pregnancy. And what is the effect of anemia in pregnant woman? It affects the maternal health, like mother will be having fatigueness all the time, and she will be very much susceptible to infections and very poor tolerance to blood loss. If the pregnant woman is having anemia, she will be 2 times more increased risk of having preterm delivery and 3 times more risk of having low birth weight baby. And this infant of mother who is having anemia in pregnancy will have anemia in first 3 to 6 months of their life. And most important and dangerous complication of anemia in pregnancy is these women will be having increased risk of having postpartum hemorrhage. And postpartum hemorrhage is the most leading cause of maternal mortality. More than 80% of maternal death is due to hemorrhage. And most of the time, these deaths will be preventable if we give adequate reproductive health services. And what are the symptoms of anemia? How the woman will know she is having anemia? She will be having pale skin, dizziness, weakness, breathlessness, palpitation, and she will be having headache, and most of the time she will be having swelling in her both legs. How can we prevent or treat this iron deficiency anemia? There are 3 measures. First is dietary measures, second is iron supplementation, and third is blood transfusion. First and foremost is dietary supplementation, and the pregnant woman should take iron rich food. Some of the iron rich foods are liver, chicken, meats, and vegetables like broccoli, potato, tomato, and in fruits we have pomegranate, watermelon, etc. The next step is iron supplementation. Iron can be supplemented either as an oral route or as injections. Oral iron should be taken by every pregnant woman from 12th week of their pregnancy, because in pregnancy iron demand is more, and also they should have adequate iron storage in her body to withstand pregnancy, delivery, and postnatal period also if they are lactating. And especially if the woman is having repeated pregnancies or very short inter-pregnancy interval, their iron storage will be depleted. So while taking oral iron tablet, there is something to be keep in mind. Like if you take oral iron tablet along with vitamin C tablet or citrus juice or fruits, it enhances the oral absorption of iron. And things like tea, coffee, red wine should be avoided while taking oral iron tablets, because these things inhibit absorption of oral iron. Ideally, iron tablets should be taken between 2 meals or at the bedtime. Next is injection irons. To whom we will give injection irons? If the patient is having severe anemia, we will give injection irons. And again, if the patient is not responding to oral iron therapy, or the patient is having very much intolerance to oral iron, or if the patient is having any intestinal diseases which prevent oral absorption of iron, we can give her injection irons. And what is the role of blood transfusion in iron deficiency anemia? If the patient is having severe anemia, or any time the patient is having symptomatic anemia, we will directly give her blood transfusion. And again, if the hemoglobin is less than 8 gram and the patient is in advanced stage of pregnancy, that means she is already crossed the 36 weeks of pregnancy, then it is better to give blood transfusion for the rapid recovery of anemia. Take home messages. Iron deficiency anemia is the most common type of anemia, and dietary measures is the first and foremost treatment and prevention of iron deficiency anemia. And every woman should take iron tablets prophylactically from 12th week of pregnancy. And preventing and treating iron deficiency anemia definitely improves the national productivity and decreases the maternal mortality. Thank you.